Well, last year when the economy was cratering and the federal government moved swiftly to enact a stimulus package to prop up failing banks, troubled home loans, and members of the wrecked financial markets, there was also money earmarked to push for technology improvements in the U.S. healthcare system. Now, it didn't garner much widespread attention at the time, and it's still flown well below the radar in the current healthcare debate. However, many firms and healthcare players are trying to figure out how to access the funds to drive inefficiencies out of the system and to produce savings. I caught up last week with Dr. Scotty Bolding, whose medical services company, U.S. Health Record, is poised to be a major player in the healthcare information technology debate. Let's talk a little bit about what U.S. Health Record does. Give me the 60-second elevator speech there.
Well, Roby, U.S. Health Record is a technology that's a health record platform for patients and hospitals and doctors to be able to share health record information. We started the technology several years ago. We've actually been in the technology development for over 15 years. But it's our principle behind our product that really has gained the momentum that we have across the country today. In 1989, the co-founder and I, Dr. Rick Robley, co-authored a textbook called Interdisciplinary Dental Facial Therapy. And that textbook's principle was that every patient needed one health record so that all doctors would be working out of the same record. Very similar to the Mayo Clinic philosophy.
And so basically, I'm in Florida, say, and I get hospitalized or I have to go seek some medical attention, and a doctor could access my records electronically and without having to communicate with me necessarily if I couldn't, and find out my medical history, what conditions I might have. That's the concept, right?
Absolutely. So let's say you have a CT scan in Little Rock and you travel to Fayetteville, or let's say New York, and you have an accident or you have a need for another healthcare provider to look at that information, and they need a CT scan. Well, today, and it happens every day, and that's part of the increased cost that we're seeing in our healthcare model, is duplication of tests. And so you'd be able to share that CT scan or that information with your healthcare provider in a different location.
Let's talk about the fact that there is some federal stimulus money that has been moved, I think late last year, early this year, to make this conversion to these electronic medical records. How much money is out there in the system, and is it moving?
Roby, well, that's a great question. It's interesting if you look at the history of health information technology. The one thing that we all agree on is that we need to decrease the cost of healthcare. As you know, there's a major healthcare debate going on in the Capitol today, and there's a lot of topics that need to be discussed. The one good news is it's a bipartisan agreement that health information technology should and will help this problem. And it actually is interesting. If you look at the history, George Bush had a presidential order that by 2015 that all healthcare providers that were Medicaid and Medicare providers would have to be in an electronic health record system, and including electronic prescriptions. The problem was there were no funds available to assure that the hospitals and the doctors could do that. So the Obama administration, with the ARA stimulus funds, and there's roughly around $24 billion available in the ARA stimulus fund that is earmarked for health information technology. And just recently, approximately a month ago, Vice President Biden and Dr. David Blumenthal, the Office of the National Coordinator of Health, released the first round of those stimulus funds, which is $1.2 billion. And that first round is incentivizing states to create electronic health record exchanges and electronic health record regional extension centers to help doctors and hospitals deploy and implement electronic health records. So we now have this year a stimulus release to encourage states to begin adoption. The interesting thing about that also is that these states, are over the next 3 to 4 years, are encouraged to quickly adopt electronic health records in their states and work with other state efforts as well. And there's penalties associated with lack of adoption. So as we go in time, eventually those funds will dry up, but the states will still have to comply. So there's a real strong incentive for them to be early adopters. There's also incentives built in now for the physicians with tax rebates to adopt electronic health records, as well as Medicare tax credits for the hospitals.
Well, you mentioned the $1.2 billion that's been released, $24 billion total overall. Is that enough money in your estimation to make this conversion that every American could have these types of electronic medical files?
Well, Roby, it's a start. One of the things that I'm concerned about, and many others are, is that there's a lot of stimulus money available now. What are we going to do with that money? What kind of technologies are we going to buy? And are those technologies going to work? And that's one of the things that we're doing at U.S. Health Record. We're about the patient and the doctor. So a lot of the technologies that are out there are large, heavy technologies that actually connect hospitals and really don't give that functional layer down at the doctor-patient level. Since we're web-based, and what we've in the 15 years of experience we've had in giving that patient their own record, we have our system comes in and actually can help a state or a community or a hospital and a doctor at an affordable price and create a sustainable model for these states to come. The concern that we have is these states, as they begin to adopt technology, connecting the hospitals, connecting the emergency services, connecting the hospital, connecting the doctors, and can they sustain that? So the technologies that are out there are going to have a model that will allow the states to sustain it, and also have a technology that's cost affordable for the physicians to be able to implement and sustain long term. So we believe that the at least this first stimulus round can get it kick-started. And hopefully, if we're very wise and we're good stewards with our technology and our money, it will be enough. Because one of the things that we're looking at with the technology is cost savings. Some of the estimates out there, as far as the studies are concerned, show that a state-wide implemented health record system that's done properly, that allows for the connectivity and all the constituents to be able to work on a common platform, where the studies show anywhere from a 10 to 14% savings. So let's translate that, for example, to Arkansas. Arkansas spends around $16 billion overall in their health care expenditures in the state. So just imagine, if we hit that mark, that's about a $1.6 billion savings. Let's say we only hit half that mark, and we're at a $500 million of savings. It's still a substantial savings effort that we've been able to help within the state, and take those funds and then use them wisely in the various programs that are going on now with this healthcare reform debate.
Well, obviously, this is all not going to happen overnight, and it's not going to happen in all 50 states at one time. Where are we going to see maybe the first indication of this whole conversion process happening in a way that we will see the value and the benefit of it?
Well, you're already starting to see some of the states that have already implemented the process before even the release of the stimulus fund. For example, in Vermont, they've started an exchange service. Recently, there was an award for a health information exchange in Alabama and Kentucky and Hawaii. So you're starting to see some states realize that there is a significant advantage adopting technology in their states to allow for the cost savings. So we're already starting to see that in the market. The problem that we've had is we need technologies that reach out to the doctor level. And so I think what you're going to see over the next, I would say, 6 to 12 months is a substantial interest in the electronic health record, both for the patient, at the doctor level, the dentist level, the hospital level. And I think you'll see this spread out over time in the various communities. And our strength, I think, is we've started it from a grassroots level. We think that every healthcare transaction, the big debate is about healthcare, the insurance reform, and the waste in the payment processes. But everyone keeps forgetting about the patient and the doctor. Managed care has forced these doctors to force the healthcare community and the physicians to try to make medicine a volume-based business. Medicine is not a volume-based business. So doctors' reimbursements continue to go down, and they're trying to see more patients to make up the difference. And we can't do that to our citizens. We can't do that to our physicians. So we've got to give them the tools that are affordable, that will allow them to start implementing these changes.